Prostatitis imaging. Talk first about anatomy of the prostate. Prostate extends from bladder neck to membranous urethra, divides prostate into anterior and posterior glandular structures. Vermentonum, prostatic utricle, ejaculatory duct opening, internal urethral sphincter at the bladder neck, external urethral sphincter at the bladder apex. This is imaging demonstrates structures, loops of the urethra, central loop, peripheral loop, transitional area or zones, vermentonum, urethra. This is imaging in longitudinal planes. This is orientations of the image of urethra in transrectal ultrasound. This transverse axial view showing prostate, right and left anterior. This is longitudinal view showing prostate, central and peripheral loops. This is urethra extending inside, central and peripheral loops. The seminal vesicle phase difference seen posterior to the urethra. Both seminal vesicle and phase difference in lateral. Both seminal vesicle and phase difference in transitional and longitudinal images. This is prostatic T base, prostatic base, showing in this image transrectal ultrasound, peripheral zone and urethra central, anteriorly, transitional zone, central zone. This is mid prostate transverse sections showing peripheral loops, vermentonum, urethra, central zones, central zone and transitional zone. Prostatic apex transverse section showing peripheral part, urethra, and this is apex of the prostate. Mid prostate longitudinal section showing urethra, peripheral zone, central zone, transitional zone on both sides of the urethra. Periprostatic structures include urinary bladder, obturator internus, levator ini, anterior periprostatic fat, pubic bone, neurovascular bundles, and rectal wall. This is both seminal vesicles. This is periprostatic structures. Periprostatic structures in both sides. Normal MRI of the urethra in transverse image, including peripheral zone, central zone, anteriorly urinary bladders. This is MR. We see peripheral zone, coronal image, central zone, neurovascular bundles in both sides. In axial image, we see prostate, posterior to it rectum, anterior urinary bladder, central zone and peripheral zones. Prostatitis, infection or inflammation of the prostate gland, may be acute prostatitis, chronic vocal prostatitis, which is symptomatic, or oligo or asymptomatic. Chronic vocal prostatitis, defined as typical pelvic or perineal pain lasting more than 3 months, can be bacterial or non-infectious. Category 3 prostatitis, known as chronic pelvic pain syndrome, is a common condition if unclear etiology and few validated effective therapies. It's even controversial whether all patients with chronic pelvic pain syndrome have prostatic pathology. National Institutes of Health classified prostatitis into 4 distinct syndromes: acute bacterial prostatitis, chronic bacterial prostatitis, chronic prostatitis, and chronic pelvic pain syndrome, further classified as inflammatory or non-inflammatory, asymptomatic inflammatory prostatitis. Prostatitis may be diffuse or focal, involve inner or outer gland, acute, chronic, or granulomatous. Ultrasonographic finding in prostatitis: enlarged prostate, diffuse enlargement or focal enlargement, High density mid-range echoes represent corpora amyloca concretion and calcification. Vocal hypoechoic region in the peripheral zone of the gland and mid-range echoes represent inflammation, fibrosis, or pus. Echolescent zones secret fluid collection suggests abscess formation. So we have different echoes in ultrasound in prostatitis, either high density or hypodensity or mid-range echoes or echolescent areas. Other signs include capsular irregularity and thickening, ejaculatory duct echoes, periurethral zone irregularity. Color Doppler ultrasound demonstrates increased flow in the periphery of the abscess. Granulomatous prostatitis present as vocal hypoechoic lesion. So, we summarize enlargement of the prostate, diffuse or vocal, different echoes from high to low to hypo to echolescent echoes, capsular irregularity, increased flow in the periphery of the abscess, or vocal hypoechoic lesion in granulomatous prostatitis. Truss finding, transrectal ultrasound finding in prostatitis, edema of vermentinum, edema of the prostatic lobes peripheral zone, dilated ejaculatory ducts, changes of the seminal vesicles, median prostatic cyst, uretrical or Mullerian cyst. CT finding in prostatitis, abscess present or seen as rim enhancing, unilocular or multilocular, hypodensity in the peripheral zone, and enlargement of the prostate. Infection can extend through capsule into periprostatic tissues like seminal vesicle and perineum. MR finding in prostatitis, prostate will be diffusely enlarged, often associated with inflammatory changes of periprostatic fat and of the seminal vesicles. In acute prostatitis, in T1, we see peripheral zone iso or hypointense to the transitional zone. In T2, hyperintense. T1 with contrast, diffusely enhancing areas involvement. Chronic prostatitis in MRI show heterogeneous gland which differentiated from cancer in the peripheral zone. Prostatic caliculi, it's one manifestation of the prostatitis. This common finding, prostatic caliculi, prostatic concretion, calcification formed within prostate gland. It is mainly composed of calcium carbonate and or calcium phosphate. They are usually asymptomatic. These caliculi can be well demonstrated in plain X-ray and CT. Group 1 prostatic caliculi associated with prostatitis. Group 2 prostatic caliculi associated with hypertrophy of the gland. Group 3 prostatic caliculi that simulate carcinoma. Group 4 caliculi in both prostatic urethra and urinary tract. Some small multiple calcification are normal in prostate. Often incidental ultrasonographic find in the prostate represent a result of age rather than prostatic pathology. However, large prostatic caliculi may be related to underlying inflammation and require further evaluation, possibly treatment. Small multiple concretion corresponding to corpora amyloca, prostatic parenchymal caliculi, usually incidental finding. Prostatic concretion of corpora present as small spherical or ellipsoid bodies. Number increases with age, may become calcified as male ages, may simulate carcinoma. This is prostatic caliculi, as we see occurs in junction with benign prostatic hyperplasia. This is concretion of corpora localized in periurethral gland. As the gland enlarged, caliculi at present a surgical capsule may dystrophic calcifications. This is characteristic of concretions of corpora. It's small spherical ellipsoid, number increase with age, may be calcified, may simulate carcinoma. And this is characteristic site in ultrasound, localized in periurethral gland. Orientation occur in junction with benign prostatic hyperplasia. As gland increase, caliculi present at surgical capsule may be show dystrophic calcification. Small multiple caliculi spherical bodies. This is longitudinal transrectal image of the left lobe show prostatic extensive concretions. This is concretions of the prostate. This is middle-aged patient with TRUS ultrasound. We show multiple hyperechoic foci, each one 47 mm in the inner gland of prostate and along prostatic urethra. Color Doppler show normal flow in the prostate. Color Doppler show normal flow in the prostate. This is image suggests prostatic calcification or caliculi. Calcified foci in the prostate associated with normal aging process may be result of information of corpora. This is formed by calcification of secretion of the gland seen in chronic inflammation and chronic prostatitis. Power Doppler TRUS, no significant change of the vascularity of the prostate and suggesting absence of prostatitis. Calcification of the middle utricle cyst in the prostate result dystrophic changes. These examples of large prostatic urethral calculus. This is micturating cystourethrogram show huge prostatic cavity. Small multiple prostatic caliculi type A in young patient. Small multiple prostatic caliculi type A, which is normal aging. Coarse echoes represented large secret prostatic caliculi. Coarse echoes showing secret prostatic caliculi, which is larger. This is TRUS image in male patient young show hypoechoic prostate. Gross augmentation of vascularity in the prostatic tissue. This finding of acute prostatitis. This is cases of acute prostatitis showing hypoechoic prostate, increased vascularity. This is, we see markedly hypoechoic patches in the inner zone of the prostate. Markedly hypoechoic patches. This is over vascularity Doppler imaging case of prostatitis. This is acute bacteria prostatitis, enlarged prostate, multiple hypoechoic areas, and prostatic abscess, showing an equiluscent collection, organized, heterogeneous, and this is extra prostatic spread. Acute bacterial prostatitis and abscess on CT. See enlarged prostate, hypodense areas. This is examples of mild periprostatic fat stranding. Mild periprostatic fat stranding, case of prostatitis. We see marked prostatic enlargement and transverse dimensions. This is area hypoattenuations along the peripheral zone. This is ascending from apex to the gland. Marked enlarged prostate for 5.4 multiplied by 6.5 in EB dimensions. This is examples of the prostate hypoattenuation along peripheral zone, ascending from the apex to the mid gland. Mild periprostatic fat stranding, this case of prostatitis, and marked prostatic enlargement. Normal volume of the prostate up to 25 cc. This is prostatic enlargement. We see enlarged prostate, hypoattenuating area, periprostatic fat stranding. This is examples of prostatitis. Hypoechoic spherical structures. Hypoechoic spherical structures with irregular wall, interspersed hyperechoic debris concerning for multiloculated abscess. T1 fat set and T2 show severe urinary tract infection and complicated prostatic abscess. Chronic prostatitis CT revealed multiple coarse ring-like calcification inside normal-sized prostate, which is sharply marginated. Prostate clearly absorbs contrast medium as expression of chronic prostatitis. Chronic prostatitis showing heterogeneous gland. Chronic prostatitis in MRI show peripheral areas of abnormal signals present. Prostatic abscess within TRUS ultrasound Areas peripheral of heterogeneous hypoechoic vocal lesions present in the peripheral zone of the prostate. Prostatic abscess. In this cases we see prostatic abscess in the MRI present as areas of abnormal signals, high signals and low signals. Prostatic abscess in MRI present areas of collection inside enlarged prostate, high signal and low signals in T1. This is prostatic abscess in all the man with perineal pain abnormally increased, chronic CRP, axial non-contrast post-contrast CT show asymmetric prostatic enlargement occupied by 4 cm septated fluid collection with peripheral and septal enhancement. We see note its placement periurethral calcification. This periurethral calcification, this is E. coli infection complication. Large prostatic abscess in this patient with E. coli infections. Multiple CT image show marked prostatic enlargement by confluent non-enhancing hypoattenuating regions and septal enhancement. Prostatic infection involved left seminal vesicles also. Left seminal vesicles involved. Left seminal vesicles. Seminal fasciculitis. Spliced upward of the urinary bladder with mild circumferential mural thickening and mucosal hyper enhancement consistent with UTI. After perineal transperineal evacuation, we see in follow-up resolution of the abscess. Differential diagnosis of prostatitis. Area of hypoattenuation in prostate in CT can mimic maybe prostatic abscess, cystic mass including Mullerian duct cyst, chronic prostatitis, benign cystic hyperplasia, prostatic TB. Diffusely enlarged prostate in CT differentiated from benign prostatic hyperplasia, prostatic carcinoma, chronic prostatitis, hypoechoic regions in the truss differentiated as prostatic abscess, cystic mass, chronic prostatitis, prostatic carcinoma. This is area prostatic carcinoma on the truss imaging. We see this area, hypoechoic nodules, increase the color flow. Prostatic carcinoma versus abscess differentiation in transrectal ultrasound. Prostatic abscess hypoechoic, well-defined or irregular wall, regularly typically associated with prostatitis. CDU, color Doppler refer perilesional vascularity. Prostatic carcinoma appear as hypoechoic typically in the peripheral zone or heterogeneous in high gland grade malignancy. Ill-defined border. Color Doppler refer vascularity within the lesions. In abscess, perilesional vascularity, no internal vascularity in prostatic abscess. This prostatitis in MRI, prostate T2 image reveal enlarged central zone with heterogeneous swirled appearance and the multiple well-defined nodules. Diffuse enlargement enhancement throughout peripheral gland with one evidence of vocal lesion. Example, prostatitis in MRI. Prostatitis in truss. We see in this truss hypoechoic nodular pattern of chronic prostatitis. Axial truss show multifocal hypoechoic changes in the peripheral zones. This is example of prostatitis. Prostatic abscess in truss. Truss demonstrate poorly defined hypoechoic zone with nearby an echoic center. Color Doppler ultrasound demonstrate increased flow in the periregional peripheral zone in hypoechoic structure surrounding area with no signal inside an echoic structure. In opposite to the prostatic carcinoma, we see intralesional signal of flow. Urethritis. Urethritis is another type of lower urinary tract infections. We see sign of urinary tract infection, edema of the wall, increased vascularity, enhancement. This is acute urethritis and complicated in this man with rhinogenic bladder. An enhanced CT image show diffuse uniform hyper signal in the corpus spongiosum with corresponding intense homogeneous enhancement on the postgadolinium in the T1 weighted images. Infection do not appear to interrupt tunica, dartos, or pox fascia, do not involve corpora cavernosa. Examples of acute urethritis: urethral infection complicated by benign perineal abscess, infection initially detected at contrast CT, enlarged midline abscess, and peripheral enhancement. Internal fluid: MR show corresponding inhomogeneous fluid-like collection in T2 sequence with surrounding inflammatory stranding, strong contrast enhancement, infected corpora spongiosum,